The information contained in your VA records is going to be crucial. This is the first place the VA rater is going to look. He may, when they order up your C&P exam, they may reference some of these notes. So if they're inaccurate or somebody else's or something like that, this isn't going to be helpful for your claim. Let me give you an example. Let's say you've been going to the VA and you have foot pain and you've been complaining about it for the last year. And when they ask you about your foot pain every time, if you've had 3 visits or whatever, so you say my foot pain is the same as it was when the injury first occurred. No changes. That's what you say. You've been consistent about it. Maybe you got out a couple of years ago and you've been doing constant complaints. And yep, it's still the same. Pain level's an 8. I can't do this anymore, and you have your consistent story. But the VA doctor takes what you just said and says, veteran's foot condition is stable. This is not accurate because you have foot problems. It's progressively possibly getting worse. It's definitely still at an 8. You're not saying it's a 4 or 5 and it's getting better, but the doctor will say stable. So that's not going to help you. So how would you correct that? The VA doctor's statement does not reflect exactly what the veteran complained about, and therefore it'll be unknown to the VA that the veteran's foot condition makes daily living complicated to the point they can't use their feet or else they'll be in pain. So foot condition stable, to me, stable means hunky-dory. The VA doesn't know this. This kind of throwing it off. Pain of 8. You go back 3 months later, 8. Can't walk, having problems going to work, can't play basketball anymore, social and occupational impairment, and then the stable comes in there, right? That it's going to throw that all off. And that's what the VA rater is going to go find out. And that's what the VA rater is going to go see. You don't want to be taken out of context with something little like this. These are little details. You want to make sure that you don't, you address this, because it'll be taken out of context and used as negative medical evidence instead of positive medical evidence. Check out my boot camp if you want to join me on a live session. If you need medical evidence, check out this email address right here. Email Second Strata, tell them what you need. You need help with a diagnosis, your symptoms, or a nexus. See if they can help you out with your medical evidence.